Yes, I think the outcomes could be really positive, but I've been to a number of these meetings, similar over the years, and very little has changed.
They should be starting from the bottom and working up. They should be looking at what they've already got, enhancing that, and then moving on from there. The part I found most interesting and perhaps would work better, and I mean really work, is the part about the emergency services and the planned care services.
It was interesting. Sitting at our table, we had some quite wide-ranging discussions. I think it's a huge task. I think it has to be done, no question. I think there's a huge task there, and I think there's still quite a lot of work to do. I think, from what I've heard, I think it's moving in the kind of the right direction.
I think some of them were a little bit lengthy. Some of them didn't sort of cater for everybody. There was a bit that said sort of like free from disease, and being the sector that I work from, it's all about reducing risk. You can never be free from, you can never prevent. So terminology struck me a little bit as difficult. So incorporating the two together made it a lot more beneficial for people to understand, looking at person-centred rather than going through the whole their wants, their wishes, their needs. And we came up with quite a good one, which I thought was sort of an easy read for everybody, rather than sort of somebody that maybe has a bit more articulate background than somebody that maybe hasn't. So I think that was important. So they were good. More money.
More money.
Yeah, that's all. Because if there was more in the pot, then people would be more appreciated, and carers would be more willing to do, a better job, because they'd be paid better. And I just think if there was more money in the sector and more of an understanding, the systems would work a lot easier.